Hello, this is Dr. Indra Cidambi from the United States of America, the psychiatrist. We are going to talk about question and answer in this episode. So the first question from the viewer is, what makes memory of a person suffering from schizophrenia so sharp that sometimes they remember very small details of an incident happened decades back? So the basic question, if I understood this right, why do schizophrenics have that sharp memory for a remote memory, the past remote incidents that happen in their lives? So the individuals with schizophrenia, right, they exhibit various kind of emotional response. The perception and the reality is not synchronized there. There is a huge gap between the perception and the reality. It's a disconnect, right? So having said that, not everybody has a sharp memory, extraordinary memory. Some people might have a genetic predisposition. And there's also the neurotransmitters in the brain, such as dopamine and serotonin, can impact this memory. And the brain circuit is basically the hippocampus. This is the area which is responsible for the memory. The faulty connection, abnormal circuitry connection in the brain, in the hippocampus, can lead to that enhanced memory in people suffering from schizophrenia. Apart from that, I would also add to this, it could be a compensatory mechanism. For the loss of other things, they could be like having an extra a push when it comes to the memory. So it can be a compensatory. The brain is compensating, overcompensating in case of loss of other functioning. So it kind of gives them, the remote memory gets sharper. Added to this, it could also be because we know the emotional reaction from these people who suffer from schizophrenia is significant. So that can lead to the repeated rehearsal of what has happened emotionally, which was taxing or challenging. So the repeated rehearsal can really lead to that enhanced memory for that particular event or significant event that happened years ago. So based on numerous factors which we discussed here, I think the memory is enhanced in some cases, for some incidents in people who suffer from schizophrenia. The next question is, people suffering from schizophrenia may exhibit inappropriate or disruptive behavior, and they may be using vulgar language in the social setting. And why is that happening? Again, schizophrenia meaning what happens? They have a disorganized thought process. The perception and the reality is there is a disconnect. They may lose insight into social norms and the conventions. So they might not even realize when they use the vulgar language or when they are being aggressive, the impact of their action onto others in the society. This is happening because of the changes in the brain, the neurotransmitters in the brain, the deficiencies. All these things can lead to this kind of behavior. The most important thing here is that if they were to use a substance or medication, this is going to enhance this kind of behavior. Or if they don't take their medication, non-compliance with the medications that they are supposed to take, then that is going to impact on their behaviors, and this can exacerbate this kind of behavior, unacceptable, aggressive, socially inept kind of an action, that including sexual vulgar language. So all those things come into act. So therefore, the best way to approach these people with suffering from schizophrenia is not, because the next question was, should we slap them? Obviously not. That's not an answer. They have no control over this. And it's so painful because it is not a behavior problem. They cannot control the emotions. So they have an impulsive, when they feel the emotions, they can't tolerate it. They can't handle this. And so they're going to be reacting in a way that it's going to impact other people who are around them, because they don't understand the cause and effect. And the best way to react is to be empathetic, non-judgmental, and understand that this is a brain disease, and really give them support, tolerate the situation, and promote medication compliance, and also discourage them from using any kind of substances to numb their emotions, right? That's the best way to handle them. The next question is, can a couple, both schizophrenic, stay together as thoughts may be matching? Okay, they can stay together, but there are challenges and also benefits of staying together. They have the shared psychosis, right? When a couple both suffering from schizophrenia, they will not be able to handle strong emotions, and that can impact on the way they make a decision. So the decision-making skills, emotional balance, all these things can be challenging. They are not there. They cannot support each other. And also, the challenges will be like when they are in need of support, they don't get to be there the way one expects. Unless the other person has taken their medication and they are kind of stable given the schizophrenia symptoms. If they have negative symptoms versus the positive symptoms of schizophrenia, what stage of schizophrenia they are in, it all depends. So the challenge is also that, are they compliant with medication? So if you have one of the spouses who does not have schizophrenia, they can at least make sure that the loved one is compliant with medication. Here, the challenge is that both the partners are going to be leaning towards non-compliance, non-adherence to their medication, non-compliance with medications. So that becomes a challenge. The benefits, I'll say, they both have understanding and empathy towards each other. There is kind of a emotional bonding, shared psychosis. The one person saying paranoid content and hallucinations, they can be much more understanding of each other, and it will not be a flare-up. Versus the challenges also can be the financial. They will not be so stable financially, because we know schizophrenia is a downward drift disease. So they will slowly lose the capacity to be able to support themselves. So that becomes a pretty big challenge. The next question is, what is the difference between a person who is intoxicated, a drunken person, and the schizophrenic, when they act inappropriately, loud, and the behavior is socially not inept. How do we tell the difference? Yes, it is challenging to differentiate between these two. Specifically, if a person who is suffering from schizophrenia is also intoxicated, how can we tell the difference between their behavior is due to intoxication or it's because of schizophrenia, right? But having said that, there are some telling tales. So here we go. If someone is drinking, right, and they've been intoxicated, it's a temporary phase. That's up until the influence of alcohol is there in their system, they're going to behave in a certain way, and then it resolves. But the person who has schizophrenia, it is not a temporary phase. They're going to behave no matter what, whether it's in this social setting where they have had the drinks or whether they were not drinking. It doesn't matter. They're going to behave the same way. The person who is plain intoxication from alcohol, right? Let's talk about that. They'll be loud, they'll be rambling, they'll have nonsensical conversation, and they're going to be pompous, poor judgment, and being too kind of grandiose, right? Coming across as if they're abrasive. But as I said, this is all going to resolve as soon as the system gets rid of alcohol. It's just a temporary thing. The cognition can be totally back to norm, and it resolves once the intoxication is done, right? When they are no longer intoxicated. So all this rambling and unsteady gait and their impulsivity, everything resolves, and they come back to their own self, true self. And there's also remorse. After they come back to their true self, they are ashamed of their behaviors. Of course, they might go back to drinking and repeat the same thing, but they have no control over the situation while they are intoxicated. Now, if you see a schizophrenic person, the person who is suffering from schizophrenia, it's a permanent. It's not just in a social setting due to the influence of alcohol. So what is this speech look like? It's a disorganized thought process. So they're going to have nonsensical talk, erratic behavior, hallucinations, loud, paranoia, persecutory kind of content, conversation in there. And so these people are not having a connection between the perception and the reality. So you can see all these kind of symptoms, but it's a permanent one. It's not resolved. Even if the intoxication is over and they are back to norm, the baseline is not back to norm like a person who is not suffering from schizophrenia. All right? That's the difference. Hi, so in the interest of time, we are going to now stop this session, and there are quite a number of interesting questions in the pipeline, and we will be addressing them in my next episode. Until then, see ya. Have a nice one. Bye-bye.